Hi, I'm Garvin. This telecast is on Enap. Enap contains the active substance called Enalapril malate. This belongs to a group of medicines called ACE inhibitors, which stands for angiotensin converting enzyme inhibitors. So Enap is used to treat high blood pressure known as hypertension, to treat heart failure and to prevent the signs of heart failure, such as shortness of breath, tiredness after light physical work, such as walking or swelling of the ankles and feet. Enap works by widening your blood vessels. This lowers your blood pressure. The medicine usually starts to work within an hour and the effect lasts for at least 24 hours. Some people will require several weeks of treatment until the best effect on your blood pressure is seen. For high blood pressure, the usual starting dose ranges from 5 to 20 mg taken once a day. The usual long-term dose is 20 mg taken once a day. The maximum long-term dose is 40 mg once a day. Excuse me. For heart failure, the usual starting dose is 2.5 mg taken once a day. The usual long-term dose is 20 mg once daily. The maximum long-term dose is 40 mg each day divided in 2 doses. If you have kidney problems, please note that your dose of medicine will be changed depending on how well your kidneys are working. If you have moderate kidney problems, your dose will be 5 to 10 mg each day. For severe kidney problems, take 2.5 mg each day. If you are having dialysis, you take 2.5 mg each day. On days you are not having dialysis, your dose may be changed depending on how low your blood pressure is. If you are elderly, your dose will be decided by your doctor and will be based on how well your kidneys are working. Experiencing the use of Enalapril in children with high blood pressure is limited. If the child can swallow tablets, the dose will be worked out using the child's body weight and blood pressure. For 20 kilo and 50 kilogram, the usual dose is 2.5 mg each day. A maximum of 20 mg daily can be used in children who are between 20 to 50 kilos. If the child weighs more than 50 kilos, the dose is 5 mg each day. The dose can be changed according to the needs of the child and a maximum of 40 mg a day. So Enap is not recommended in newborn babies or in children with kidney problems. Common side effects include headache, tiredness, diarrhea, cough, blurred vision, feeling dizzy. And if you take more Enap than you should, talk to your doctor straight away, as it might lead to you feeling lightheaded or dizzy. If you forget to take Enap, skip the missed dose, take the next dose as usual. Do not take a double dose to make up for an earlier forgotten dose. And do not stop taking this medicine unless your doctor tells you to. And do not take Enalapril if you are allergic to Enalapril malate. If you have ever had an allergic reaction to a type of medicine similar to Enalapril called an ACE inhibitor. If you've ever had swelling of your face, lips, mouth, tongue or throat which cause difficulty swallowing or breathing caused by an unknown reason. If you are more than 3 months pregnant, if you have diabetes or impaired kidney function, talk to your doctor or pharmacist before taking Enalapril. If you have a heart problem, a condition involved the blood vessels in the brain, a liver or kidney problem, or if you have been very sick or had recently had diarrhea. If you're over 70 years of age, have diabetes or have low blood pressure. If you're about to have a procedure such as dental work or cholesterol treatment, tell your doctor that you are taking Enalapril. Tell your doctor or pharmacist if you are taking, have recently taken or might take any other medicines, including medicines obtained without a prescription. This includes herbal medicines. In particular, tell your doctor or pharmacist if you are taking other medicines to lower blood pressure, such as beta blockers or water tablets, or medicines containing potassium, medicines for diabetes, mental problems or depression, lithium, non-steroidal anti-inflammatory drugs such as ibuprofen, aspirin, or medicine used to dissolve blood clots. Alcohol can increase the effect on this medicine. Check with your doctor or pharmacist before drinking any alcohol. You must tell your doctor if you think you are or might become pregnant. Your doctor will normally advise you stop taking Enalapril before you become pregnant, or as soon as you know you are pregnant, and will advise you to take another medicine instead of Enalapril. Enalapril is not recommended in early pregnancy and must not be taken when more than 3 months pregnant, as it may cause serious harm to your baby if used after the 3rd trimester of pregnancy. Tell your doctor if you're breastfeeding or about to start breastfeeding. Breastfeeding newborn babies, and especially premature babies, is not recommended while taking Enalapril. You may feel dizzy or sleepy while taking Enalapril. If this happens, do not drive or use any tools or machines. If you have any other questions on this medicine or any other medicine, you can contact me through the live pharmacist on the website. You can just email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.